Hi, my name is Sophia Aguilar, and for my post surgical project, I'll be doing osteosarcoma limb salvage surgery versus amputation. What is osteosarcoma? It's a type of bone cancer that develops near the end of the limb, as shown here. And there's usually three types of treatments for osteosarcoma, which is chemotherapy, radiation therapy, and the surgeries. And the first surgery we'll be talking about is limb salvage surgery, which I'm gonna play the video while I talk, which is so look away right now if you don't want to see the video and see blood. But limb salvage surgery is removing the tumor without hitting/cutting any blood vessels and nerves while also keeping the limb, unlike amputation. And usually this is done with allografts or a metal prosthetic. And as shown right here in these images right here, and in this video of a metal prosthetic happening in a tibia limb salvage surgery. Um, yeah. And the recovery for the wound for it to heal would take about 2 weeks. And after the surgery, you will also have tubes in your room to drain any fluids, or your stitches will be removed within 2 weeks. You will have nurses helping you do breathing exercises to prevent any respiratory diseases. And you'll also be given exercises depending where you got the tumor removed to prevent any blood clots. Also, you'll be given TED stockings and anti-clotting medication. And TED stockings are the ones up here in the upper right hand. And also, you'd be given crunches because right after the surgery, the doctors would want you to move around as quickly to prevent any blood clotting. So the rehab, usually it takes 4 to 6 months for you to heal after the surgery, but it's a 12-month rehab program. And if it's a lower extremity surgery, it would take up to a year for you to learn how to walk again. And for the first week, you'd be doing isometric exercises, and you would stay in the hospital longer to learn how to cope until you go home, so you'd be prepared. And also, the rehab, it just depends on where you got the surgery, on what exercises you should do. But we'll be first focusing on the lower extremity. So the first step of the rehab program is continuous passive motion, which is therapy using machines to move the joint passively without the patient actually putting in an effort. Then we'll do an active range of motion and also more range of motion exercises. Then we'll move on to strengthening exercises. Oh, you will also be given a cane, a walking stick, and a walker to help you move around, or a sling for your shoulder if you got your surgery right there. Amputation, I'm also going to play a video right here, but this one isn't that graphic, so you'll be okay, but look away if you don't want. But this is usually, amputation is like when a massive tumor cannot be removed with limb salvage surgery, or the tumor is starting to spread and the doctors get worried. So in amputation is basically when the whole limb is removed, and you're going to see right here, but I'm just going to skip. But also, this is when the doctors stitch up or staple back up the two skins, creating the stump. And for the recovery time, the wound should heal between 4 to 8 weeks. But of course, this is a long-term recovery because not only is it going to affect the client physically, but also mentally, because of what they have to adapt to into their new lifestyle. And during your recovery, nurses are going to teach you how to take care of your stump. So during the first few weeks, your stump must be bandaged, and you're going to learn how to clean it properly. And until it dries, your stitches cannot be removed. But when it's dry, you can remove it. You will also be provided a shrinker sock to prevent swelling, which is this right here. So the rehab, usually it takes 6 months, but you won't be getting your prosthetic right away. But when you do, you'll be doing the same rehab as without it. But during your rehab, you'll learn how to adapt with your prosthetic and without it by working on strength, endurance, balance, mobility, and work on motor skills. You'll be doing gentle stretching exercises as shown below right here. This is where you use a towel to roll out the stump. And then all these exercises are supposed to improve muscle strength and control. And I'm gonna play some videos and just show short clips of this guy doing his exercises. This is the first exercises you do, and then I'll show you the strengthening exercises. But then also in your rehab program, you'll be doing activities to work on day-to-day stuff, like to get back into your normal lifestyle, like laundry, cooking, and just doing your daily activities. And then you will also learn how to use your prosthetic. And also, counseling will be provided to help you grieve over the loss of your limb. And I'm just gonna skip this forward so you can like see him, and then you can see him like move the stump right here. Okay, and then the strengthening exercises are going to be shown right here, and you can do many strengthening exercises. You can use a baseba, which is when you're a little bit more advanced, but like for the beginners, you're going to be putting pressure like down, and then you're going to be pushing your stump up, just to strengthen it, or side to side, just depending on like how you want to start off. But you can also use a towel to do this too, like these exercises to like pull your stump aside and then to the other side, and like to put like pressure up or down. And then you can also just use a block too, as you're going to see right here. Okay. And of course, with these surgeries, there are some complications. Like in limb salvage surgery, infection might occur, the tumor might return and will spread more. And if this does occur, then eventually this will lead up to amputation. And the allograft might fracture and might require another major surgery. But for amputation, phantom limb might occur, which is basically where the person got their limb amputated. They're still gonna feel pain in a sensitive brain, which is excruciating pain. The patient's gonna feel heart problems, and also the wound might be a slow healing process, and it might get infected. So conclusion and comparing. In conclusion, doctors do recommend limb salvage surgery first because it is a better option for a client who is very active, or just for a client who still wants to be active and continue living that type of lifestyle. But of course, amputation would be a better option if the tumor is way too big and considered dangerous by spreading to more parts of the limb. And there's no other option with chemotherapy or radiation therapy to shrinking the tumor, so amputation might be the best option. But limb salvage surgery is the best option. Also, but for amputation, you will gain a lot of support around you, not only with your rehab crew, but also with some counseling programs that have old amputees, helping newer amputees cope with life and share their experience, and also guiding them through this new journey. But these are my references. I had more, but yeah. If you want to do more research on osteosarcoma, amputation, and limb salvage surgery. But thank you for watching my project on osteosarcoma, limb salvage surgery versus amputation.